We are live, ma'am.
Please share the YouTube link with me too also so that I can check students' messages.
Sure, ma'am.
Yeah, good evening, students. So today we are here. Let me share my screen first. Okay. Yeah, I hope you can see my screen also along with my face. So today we are here for the FMG one-shot session as your FMG exam is coming up on 30th July. So for that, revision of few important topics which are frequently asked and repeatedly asked. For biochemistry, it is not difficult. It's very scoring subject. Even if you give 4 hours now to biochemistry, so you can do these repeatedly asked questions. So let's start. Let me tell you. So here I have noted down few important topics which are frequently and repeatedly asked topics for FMG exam. So if you do this page, too much of will be covering today in this session. But this session has a limitation. So obviously I won't be able to cover whole of it. So if you can sit yourself and do the revision, or if you have already read, then do the revision. If you're not read, then do either the questions, PYQs, or these topics, right? So they're asking amino acids a lot. Mostly they're asking tyrosine, arginine, leucine, homocysteine, and the disorders of amino acids like L-captonuria, MSUD, right? Then essential fatty acids, PUFAs, linoleic and linolenic acid. Then vitamins, B1, B3, B6, vitamin A, vitamin K, E, D. So all the fat soluble are frequently asked. So vitamins is a very important topic these days. They are asking this topic a lot because they want doctors to read this topic, because sometimes patient has a neuropathy and it is just because of some vitamin deficiency. So the doctor should know that. And vitamins and minerals are like, at least this topic should be very well read by a doctor. So even after the exam, just as a clinician, you should properly read these two topics along with clinical cases, right? If you just keep on reading, it is just theory you are cramming. Once you do a lot of cases along with it, then you need to interrelate that ऐसा patient आएगा तो ऐसा सोच सकते हैं कि ये vitamin deficiency, vitamin toxicity भी हो सकती है, राइट? तो उस तरीके से पढ़ना है, उस तरीके से टॉपिक को पढ़ना है. अभी तो हम एग्जाम के लिए चलो कर ही रहे हैं. देन मिनरल्स में कैल्शियम बहुत इंपॉर्टेंट है. डेंटल फ्लोरोसिस आपको पता होना चाहिए. देन कॉपर की 2 डिजीजेस हैं, कॉपर डेफिशिएंसी मेंकीज, कॉपर एक्सेस विल्सन्स डिजीज. देन आयरन की एब्जॉर्प्शन पे बहुत क्वेश्चंस आते हैं. सिलीनियम एंटीऑक्सीडेंट है, विटामिन ई और ग्लूटाथायोन के साथ काम करता है. उस पे बहुत क्वेश्चंस है, बहुत ही इंपॉर्टेंट टॉपिक है. 21st अमाइनो एसिड सिलीनोप्रोटीन होता है, उस पे सिलीनियम है, राइट? देन आरएनए एडिटिंग एंड ऑल्टरनेट स्प्लाइसिंग. ये 2 टॉपिक है मॉलिक्यूलर में जो लेटेस्ट टॉपिक्स हैं जिन पे क्वेश्चंस बहुत पूछे जा रहे हैं. सो ये हम करेंगे. देन कोलेजन, द फाइबरस प्रोटीन, that is frequently asked. देन ईटीसी में कुछ ज्यादा नहीं, ईटीसी में आपको बस कॉम्प्लेक्सेस, चारों कॉम्प्लेक्सेस उनके, पांचों कॉम्प्लेक्सेस उनके इनहिबिटर्स एंड अनकपलर्स, बस इतना ही करना है। देन ग्राफ्स, जैन 23 में भी ग्राफ पूछा गया था नॉन कॉम्पिटिटिव इनहिबिशन पे, राइट। सो फिर ये सब डिजीजेस, देन जिंक एंड कार्बोनिक एनहाइड्रेस, गैग्स, ग्लूकोज ट्रांसपोर्टर्स, ग्लूकोनियोजेनेसिस, डीएनए स्ट्रक्चर, अमोनिया ट्रांसपोर्ट, रिवर्स ट्रांसक्रिप्टेज, शेपरॉन, सिकल सेल म्यूटेशन। सो मैं एक बार जल्दी से पढ़ रही हूँ बिकॉज वी आर गोना डिस्कस मोस्ट ऑफ द टॉपिक्स फ्रॉम दिस पेज. So let me read just quickly. Kwashiorkor, galactosemia, classical galactosemia, GALT deficiency, sorbitol and diabetes, glycemic index, pathways in cytoplasm and mitochondria. कौन से pathways कहाँ होते हैं, कौन से cytoplasm में, कौन से mitochondria में, and nitric oxide synthesized from amino acid arginine, vasodilator, very very important. So let's see the questions which were asked. So all these are PYQs which I have taken in today's slide. So it is, tell me the answer. Dr. Abhi, Mr. Steve, Dr. Steve, welcome to the live session. So just try telling me the answer. Even if you're wrong, there's no negative marking in the YouTube session. So do try. Let's make it an interactive session. So try telling me the answer. I think there's a lag between the video and the... Okay, I have got your answer. Very good, Dr. Ilasa. So sometimes it's difficult to pronounce the names. Okay, so melanin is synthesized from, very good, answer is tyrosine. And tryptophan forms melatonin. So easy to learn. टायरोसिन छोटा नाम है, मेलानिन भी छोटा नाम है, ट्रिप्टोफैन बड़ा नाम है, मेलेटोनिन भी बड़ा नाम है, right? So bigger name and smaller name, they're together. So tyrosin makes melanin the pigment by enzyme tyrosinase. यहाँ पर enzyme होता है tyrosinase. This enzyme is deficient in albinism. This enzyme requires copper. So it is also affected in Menkes disease. So होता क्या है कि Menkes disease में copper deficiency होती है. जो enzyme melanin बनाता है, the pigment melanin, वो enzyme है tyrosinase और उसको copper चाहिए. तो Menkes disease में ये enzyme affected होने की वजह से children have gray hair. Hypopigmentation हो जाएगा ना, melanin pigment नहीं बनेगा. So children have gray hair because of the tyrosinase affected. So there will be defective production or decreased production of melanin. So then let's do the products of some amino acids. Very, very important. So phenylalanine to tyrosine. Phenylalanine, from diet we get phenylalanine, and then tyrosine is made in body. So tyrosine is non-essential, but phenylalanine is essential, right? Now, tyrosine makes melanin. This was the question asked. Catecholamines also, that is epinephrine, norepinephrine, and dopamine. Then is thyroxine. Can anyone tell me which is the first catecholamine to be formed? So I'll wait in the chat box. Then tryptophan. Tryptophan makes niacin, vitamin B3. So deficiency of tryptophan will also lead to pellagra, right? Or the defective formation of tryptophan to niacin will lead to pellagra, right? Serotonin and melatonin are also formed from tryptophan. Then histidine forms histamine, the one responsible for allergic reactions. Then glycine and serine, they have a lot of products. See here, glycine makes creatine, glutathione, heme, porphyrin, glyoxylate, choline, betaine, sarcosine, and serine. Serine amino acid. So the serine amino acid is formed from glycine, and serine can also make glycine again. So the enzyme which converts glycine to serine is reversible. It can convert serine to glycine also. So serine makes glycine, selenocysteine, cysteine, phosphatidylserine and sphingosine. Sphingosine वो अल्कोहल होती है जो sphingomyelin में present होती है. Sphingosine alcohol present in sphingomyelin is made up of serine and palmitoyl CoA. Next, arginine, very, very important, frequently asked. Arginine makes nitric oxide vasodilator, creatine, urea, and ornithine. Okay. So tell me the answer to this question. Next question, answer. Yes, very good. Tommy Talk has answered dopamine. So you are right. The first catecholamine to be formed is dopamine. Then norepinephrine is formed, and then epinephrine is formed. And they ask you one more thing, that which catecholamine has methyl group. So that is epinephrine. Tell me the answer to this. Yeah, tell me the answer. Try. Answer is glycolysis. Glycolysis occurs in cytoplasm. TCA cycle occurs in mitochondria. Beta oxidation of fatty acid occurs in mitochondria, especially in liver it occurs. Gluconeogenesis occurs both in mitochondria and cytoplasm. Gluconeogenesis occurs both in mitochondria and cytoplasm. The pathways which occur both in mitochondria and cytoplasm are frequently asked. Heme synthesis, urea cycle, and gluconeogenesis. These three pathways occur both in mitochondria and cytoplasm. Okay. So let's do this chart, which will help you solve all these frequently asked questions. So cytoplasm, which pathway occurs in cytoplasm? HMP, glycogenesis, glycogenolysis, glycolysis, fatty acid synthesis, and cholesterol synthesis. Okay, so HMP, then glycogenesis, glycogenolysis, glycolysis, and then fatty acid and cholesterol synthesis. On the other hand, in mitochondria, beta oxidation of fatty acids, link reaction, ketone body, any pathway of ketone body occurs in mitochondria, whether it is ketone body synthesis or it is ketone body utilization. Then vital pathways, TCA, ATC, both occur in mitochondria. Then we have DNA in nucleus. Also, we have DNA in mitochondria also. The mitochondrial DNA, replication, transcription, translation, all occur in mitochondria only, right? Like for nuclear DNA, replication and transcription occur in nucleus, but translation occurs in cytoplasm. But for mitochondrial DNA, all the three, replication, transcription, translation, all occur in mitochondria, right? And then apoptosis in mitochondria. So next question, tell me the answer. I just told you this. So everybody knows this. What is the answer? Vasodilator nitric oxide is synthesized by which amino acid? It is L-arginine, or any amino acid is L-amino acid, right? D amino acids are rare. D are rare. You should be knowing the example. D-serine and D-aspartate, they are found in brain. Once this question was asked. D-serine, D-aspartate found in brain. So arginine is formed from nitric oxide by which enzyme? It is nitric oxide synthase, NOS, nitric oxide synthase. It is a multi-enzyme complex. It is a multi-enzyme complex. It requires 5 coenzymes. It requires 5 coenzymes, tetrahydrobiopterin. What is this THB? It is tetrahydrobiopterin. Sorry, I have dry throat today, so I'm frequently having these coughs. So FMN, other coenzymes for nitric oxide synthase, FMN, FAD, NADPH, and heme. Okay, all these 5 coenzymes required for nitric oxide synthase, which is a multi-enzyme complex. And one more question was asked, which second messenger is involved in the vasodilatory action of nitric oxide? The second messenger involved is cyclic GMP. In phosphorylation and dephosphorylation, enzyme regulation for hormones, insulin, glucagon, the second messenger involved is cyclic AMP. But here for nitric oxide, it is cyclic GMP. Can anyone tell me one more place where cyclic GMP is important, second messenger? One more place where cyclic GMP is required is vitamin A visual cycle. So you have to learn only 2 places for cyclic GMP. One is nitric oxide vasodilatory action, other is vitamin A Wall's visual cycle. Then next, this question was asked, following are the reasons for thiamine deficiency except. Can you try telling me the answer? Let's try once. Thiamine, that is vitamin B1. Thiamine is B1. What does thigh mean? You have to be careful. THY, thiamine is a pyrimidine. It's a pyrimidine, thiamine, uracil, cytosine, right? But thiamine, THIA, is vitamin B1. So be careful. So answer is veganism. So let's read the causes of B1 deficiency. There are a lot of causes of any vitamin deficiency. So for B1, it is diet rich in polished rice or processed grains, because the outer covering of the grains, aleurone layer, has a lot of vitamin B1. So if that is lost, then B1 deficiency will occur. That's the good source of vitamin B1 in diet. Then if parenteral nutrition is given to some patient where vitamin B1 is not sufficient, right? Then chronic use of diuretics. With diuretics, lot of urine, lot of water is coming out. Vitamin B1 is a water-soluble vitamin. So this is found to be getting lost in urine along with diuretics. And the excretion of thiamine in urine is directly proportional to urine flow. Then if patient has prolonged diarrhea, so absorption of vitamin B1 is affected, or any other intestinal disorder where absorption of vitamin is affected. Then chronic alcoholism, alcohol and vitamin B1 deficiency is too much interrelated. Almost every chronic alcoholic patient will be having B1 deficiency, right? And because of B1 deficiency, these patients have lactic acidosis also. When you read glycolysis and link reaction, only then you can understand this lactic acidosis. Right now, you can just note that lactic acidosis occurs in chronic alcoholism where there is B1 deficiency, right? So what is the reason of alcohol and B1 deficiency? One is that these patients are not eating much. So lack of nutrition is there. They're just focusing on drinking. And other is alcohol directly interferes in the absorption with B1. It directly interferes in the absorption of vitamin B1. There is hyperthyroidism. Increased cell metabolism, so there's increased demand, increased requirement of B1. Then is gastric bypass surgery or bariatric surgery. Decreased oral intake and excessive nausea and vomiting is the reason. Then chronic kidney disease. In chronic kidney disease, for folate and thiamine, there's down regulation in the expression of their transporters. There's down regulation. So there's decreased absorption. Absorption is affected, right? So these are the causes of B1 deficiency. Let's look at the question once again. Following are the reasons for thiamine deficiency except. So alcohol, diuretics, bariatric surgery, chronic renal failure. All these are causes of B1 deficiency. But in veganism, mostly patients have B12 deficiency. Not patients, these people have B12 deficiency. So this B12 B12 is not there in any plant source. It's not obtained from any plant source. But yes, those vegans who are taking probiotic drinks, right, fermented drinks, they will be having good bacteria, probiotics. So these bacteria can make B12. B12 is the excreta of bacteria, right? So it is not necessary to eat or non-veg or eat animal products. B12 can be obtained from probiotics also, right? Yeah, human body cannot synthesize B12. Plant sources are not having B12. That is true. Okay. Next is xerophthalmia or conjunctival xerosis occur due to deficiency of which of the following vitamin? Very easy. You can tell me the answer. Answer is vitamin A. Xerophthalmia, dry eyes, right? So that is because of vitamin A. B1 deficiency lead to beriberi. B3 deficiency lead to pellagra. There are 3 Ds of pellagra. Dermatitis, photosensitive dermatitis, or Casel's necklace. Very, very important and frequently asked. Dementia, diarrhea, death, even delirium. Not only 3 Ds, but there are many Ds in pellagra. And vitamin D deficiency will lead to osteomalacia in adults and rickets in children. So this was xerophthalmia or conjunctival xerosis that occurs in vitamin A. So let's see all the clinical features of vitamin A deficiency. This is classification given by WHO. So patient has night blindness. In sequence, all these things happens. Night blindness, then conjunctival xerosis. Conjunctiva starts getting involved. Then foamy appearance on the conjunctiva due to excess keratin deposits. Actually, vitamin A will decrease keratinization, or we can say it will control the keratin deposits in the body. It will not allow it to go excess. So in vitamin A deficiency, there will be excess of keratinization, excess of dryness, right? So corneal xerosis, corneal ulcer covering less than 1/3 of the corneal surface. Then because advancement is happening in the sequence, this is a sequence of vitamin A deficiency symptoms in severity, increasing severity. So patient has then corneal scarring and then xerophthalmic fundus. Okay. The next question, try telling me the answer. COVID patient was discharged from hospital and was recovering at home. In order to join back his duties, he himself started taking excessive multivitamin. And he developed symptoms of nerve sensations, tingling sensations. Which of the following is most likely cause of associated symptoms seen in this patient? This is B6 deficiency. In B6, this is B6 excess. In B6 deficiency also, there is neuropathy. So symptoms of pyridoxine toxicity are sensory neuropathy, numbness, tingling sensation. This is called mega vitamin B6 syndrome. It's a large fiber neuropathy. Then patient can have seizures, cognitive impairment, photosensitivity, because B6 deficiency always lead to B3 deficiency. So you can see the features of pellagra also. Depression, dermatitis, right? Then these patients also have GI symptoms like nausea, vomiting, and impaired glucose tolerance. So this is very beautiful that B6 is unique in that either a deficiency or an excess can cause a neuropathy. How excess causes neuropathy? Because pyridoxine is converted to pyridoxal phosphate. Pyridoxal phosphate via 2 enzymes, pyridoxal kinase and pyridoxine 5-phosphate oxidase. So one is kinase, one is oxidase. So high levels of pyridoxine will inhibit these enzymes. So pyridoxal phosphate, which is the active form that is not synthesized, leading to mimicking a deficiency of vitamin B6, right? So it will be a deficiency of vitamin B6. Although it's excess of vitamin. So that's why deficiency or excess both are leading to neuropathy. Next question, for coronary artery disease prevention, which needs to be given? Because omega-3 PUFAs are cardioprotective, so omega-3 are preferred. So omega-3 are cardioprotective because they're anti-inflammatory. They affect membrane fluidity in a positive way. They prevent conversion of omega-6 PUFAs to pro-inflammatory eicosanoids, and they transfer cell signaling molecules. So in short, you just have to remember that omega-3 are cardioprotective. That's it. No need to know the reason. We have just read it once. Okay. So reading once is good by chance if question is asked, but mostly it will not be asked. You just need to know that omega-3 are cardioprotective. Next is, which of the following is not a micronutrient? I will say that this is a more of common sense question. If you read the options copper, calcium, chromium, iodine, you can guess that calcium is present in our bones. So obviously it cannot be a micronutrient. So answer is calcium, right? Even if you don't know this theory part, then also you could have answered. So always try to solve the question. Sometimes there are many common sense questions. Even if you have not read the topic, you will be able to solve just by your common sense, right? So don't get afraid when you read a new question in an exam or the question which you have not, for which you have not read that topic. Okay. So let's read the theory also. Major elements or micro or macro minerals, major or macro minerals, they're required in quantity of more than 100 milligrams per day. These are calcium and phosphorus, then sodium potassium chloride, and then magnesium sulfur. So easy to learn: calcium, phosphorus, sodium potassium chloride. And then you just need to add magnesium and sulfur, M and S. Okay. Then micro minerals or trace elements are those which are required in a quantity of less than 100 milligrams per day. These are all the remaining: iron, fluorine, copper, cobalt, chromium, manganese, molybdenum, zinc, selenium, iodine. All are required in trace amounts, right? Very less amounts. Next, try telling me the answer. Although ApoB48 and ApoB100 are derived from same gene, but they are finally translated into separate proteins. This is due to RNA editing. RNA editing and alternate splicing. These both are responsible for making more than one proteins from one gene. So they do not follow one gene, one protein theory. Here, one gene can give rise to more than one protein. So it is RNA editing and alternate splicing. So RNA editing, best example is understanding ApoB48 and ApoB100 mechanism. So see this picture. So this is DNA. Transcription will make RNA. Translation will make protein. Right. So here ApoB100 gene is present in both intestine and liver. Same gene present in intestine and liver. But in intestine we have ApoB48. But in liver we have ApoB100. So what happens is that the edited, there's a stop codon. So let's first look at the RNA. So CAA gives glutamine, right? So C gets converted to U. C gets converted to U. This is RNA editing. We have edited the RNA. In RNA, this change happens. Okay. This is not a very detailed diagram. That's why you cannot see that. But this change will occur in RNA. C to U. Okay. Now, UAA is the stop codon. So, this stop codon is present in intestine, not in liver. Okay. So, in liver, the full length is transcribed or translated. So, that is the unedited one. Okay. But in intestine, it is the edited one with the stop codon, because when half of 100 is 50, near to that is 48. So there is creation of a stop codon almost in the center of the mRNA, right? So the translation, when translation will occur, protein will be of smaller size, right? So answer is RNA editing. Next is, which of the following has highest glycemic index? What is the answer? Do you want to try? Yeah, answer is glucose. Glucose and galactose have glycemic index of 1, dietary fiber 0, and low glycemic index for fructose, sucrose, starch, and sugar alcohols. So low glycemic index, 55 or less. So if you see the scale of 0 to 100, then different numbers we can say. 55 or less is low glycemic index, fructose, beans, and grains. Medium glycemic index, 56 to 69, table sugar or sucrose. High glycemic index is high fructose corn syrup, glucose, sweets, rice, and maltose. So glycemic index is rise in blood glucose after 50 gram of glucose ingestion. It ranges from 0 to 100. High glycemic index foods are quickly absorbed and give a rapid rise in blood glucose. They give a rapid rise. बहुत जल्दी blood glucose increase हो जाएगा, right? So amount of food doesn't depend, but the how much blood glucose is raised, right? So that is important. And low glycemic index food, they have slow absorption. So slowly, patiently, we can say the glucose will be released into the blood. And obviously, these are more beneficial, right? Low glycemic index foods are very much beneficial for metabolic syndrome, diabetes, hypertension patients, right? So this question was also once asked, which of the following is low glycemic index? Options were potato, watermelon, papaya, and sweet corn. Here answer is sweet corn because of the high fiber in corn. High fiber content in corn. Fibers impart low glycemic index because fibers will hold the glucose molecules in between. So slowly, they will release from the intestine. It will be slowly released and obviously low glycemic index. Potato and watermelon, they have high glycemic index. Papaya, medium, and sweet corn, low. Then next, absolute contraindication for breastfeeding. Absolute contraindication for breastfeeding is galactosemia. All these are infections. No infection is a contraindication for breastfeeding. Absolute contraindication is galactosemia because milk is lactose. Lactose is made up of galactose and glucose. And due to galactose, this child can get mental retardation. So in order to prevent mental retardation, this is an absolute contraindication, right? So mother's milk or breast milk is lactose. Lactose has galactose. If the patient cannot metabolize galactose, then patient will be having mental retardation. The child, newborn child, can be mentally retarded just because of the mother's milk here. So that's why this is absolute contraindication. Otherwise, no infection is a contraindication for breastfeeding. Next, which of the following compound is most likely to cause diabetic cataract? most likely to cause diabetic cataract? Answer, it is sorbitol. So if you have read sorbitol pathway, so in sorbitol pathway, what happens is a glucose forms sorbitol by enzyme aldose reductase. Then sorbitol forms fructose by sorbitol dehydrogenase. This is sorbitol form. This is fructose, so formed in body required for sperms, etc. Right. Now, in case of diabetic patient, in diabetes, there is excess of glucose. It will form excess of sorbitol, but sorbitol dehydrogenase enzyme is not present in all the cells. It is only present in seminal vesicles, right? It is not present in all the cells, but this aldose reductase, the first enzyme, is present everywhere. It is a general enzyme. So this sorbitol will be accumulated. It is hygroscopic alcohol. It is hygroscopic in nature, so it will attract water. It will absorb water, so it will cause cell swelling. And the sorbitol is responsible for snowflake cataract in diabetes patient. Okay. In galactosemia patient, oil drop cataract occurs. Next, defect in which of the following essential amino acid metabolism can cause cardiac problem? So here answer is methionine, because in the metabolism of methionine, homocysteine is formed. In the metabolism of methionine, which is an essential amino acid, so homocysteine is formed, and excess of homocysteine can lead to atherosclerosis and myocardial infarction. Also remember, homocysteine excess can occur in B6, B9 or B12 deficiency also, right? It can occur in B6, B9 or B12 deficiency. Then in recall questions, either this question was asked that which of the following essential amino acid can prevent cardiac problems? So options were tryptophan, leucine, isoleucine, phenylalanine. So here answer is leucine. So it's a different recall questions given by some students. So whatever the question is, we are not worried about that. We don't want the exact question. Sometimes when it is not obtained, then what we do that, whatever we have got from students, we try to read the theory about that, right? So it's okay if we have not got the right question, but we can read the theory and our purpose is solved. Okay. So answer is leucine, because recent research suggests that leucine may have potential benefits for cardiovascular health by following mechanisms. It promotes the production of nitric oxide, which is a vasodilator, so it improves the blood flow. It reduces inflammation and oxidative stress. It also improves insulin sensitivity, so glucose metabolism is improved due to leucine. So recent research has shown this. So you must read it once, because sometimes the questions are coming from research papers. They're not in your books. So we must read such latest information. So you can see the sequence that best answer will be glycine if glycine is there. Then next best will be taurine and next best will be leucine. Okay? They all prevent triglyceride deposition. And the mechanism is not known, just that these supplements have been seen to improve heart conditions. Right? So what is the role of glycine? Glycine was most important out of this list. Glycine exerts anti-inflammatory and antioxidative effects. It has anti-inflammatory and antioxidant effect. Then this is very clear for everyone. What is this? Hazel's necklace. There's no need to read the question also. Na? Answer is B3. But we should always read the question. A 36-year-old male presents to OPD with rashes around his neck region, diarrhea last 3 days, and recent forgetfulness, dementia, diarrhea, and dermatitis. 3 things are given in the very first line. He's hailing from northern states in India and is mainly surviving on maize-rich diet. Maize protein zine maize protein zine lacks tryptophan. So when tryptophan is not there, then vitamin D3 cannot be formed. Okay. Next, which of the following enzyme simultaneously incorporate molecular oxygen and produces water? Answer is cytochrome C oxidase. ETC complex 4 of ETC cytochrome C oxidase. It incorporate oxygen and produces water. It incorporates oxygen and produces water. Complex 4 of ETC, right? What about catalase? Other options. Catalase is present in peroxisomes. It is present in peroxisomes to destroy the hydrogen peroxide. It converts hydrogen peroxide to water, right? Then superoxide dismutase. It uses superoxide as which is a free radical. That's the special thing about this enzyme. A free radical superoxide is the substrate here, and it is converted to oxygen. Right? Finally, it is converted to H2O2. So from a more harmful free radical, which is superoxide, it is converting it into less harmful, that is hydrogen peroxide. Superoxide dismutase, SOD. It has mitochondrial form and cytoplasmic form. Mitochondrial form require manganese. Cytoplasmic form require copper. M for mitochondrial, M for manganese, C for cytoplasm, C for copper. Okay. So this is also frequently asked in MCQ for SOD, superoxide dismutase. Mitochondrial form requires manganese as cofactor. Cytoplasmic form requires copper. Then isocitrate dehydrogenase. It uses NAD and forms NADH. It releases carbon dioxide. So hydroxylase enzymes also incorporate oxygen. You need to know this. Hydroxylases are monooxygenases. Isocitrate dehydrogenase uses NAD and produce carbon dioxide and NADH. There's a TCA cycle. Then mode of action of dicumarol, it is vitamin K inhibition. So there are three things: dicumarol, dimercaprol, disulfiram. Dicumarol, so you have to be very careful for these three, which one is asked. Dicumarol, vitamin K antagonist. Dimercaprol or British antileucide, it inhibits complex 3 of ETC. Disulfiram, it is used in alcohol interabuse. It inhibits enzyme aldehyde dehydrogenase. Then a patient presented to OPD with features of collagen vascular disorder, which of the following deficit is most likely to be associated with defective collagen formation. Options are ascorbic acid, copper, iron, both A and B, zinc or magnesium. Ascorbic acid, copper, iron, all are required for collagen maturation because the hydroxylases, prolyl and lysyl hydroxylases require vitamin C, ascorbic acid and iron. On the other hand, lysyl oxidase, which is involved in the formation of crosslinks in collagen, it requires copper, right? So copper, iron, vitamin C, all are required for collagen maturation. Then which is deficient in von Gog's disease? Von Gog's disease is type 1 glycogen storage disease. Enzyme deficient is glucose 6-phosphatase. This enzyme is involved in gluconeogenesis and glycogenolysis. Next, a very clear picture of sunflower cataract is there. And sunflower cataract occur in Wilson's disease, which is copper excess. So the question is, patient has liver damage. In Wilson's disease, copper is increased in liver. His eyes examination showed the given picture. Patient also has neurological manifestation, CNS also affected in Wilson's disease. Which factor is responsible for this disease? It is copper. right? So in Wilson's disease, copper is increased in liver, leading to liver damage. Then from liver, it will be going to extrahepatic tissues like brain, kidneys, bone marrow, RBCs, leading to damage to all these tissues. Hemolytic anemia because RBCs also have copper. And in eyes, there are KF rings and sunflower shaped cataract. What is KF ring? These are Kayser-Fleischer rings. Kayser-Fleischer rings. This is brown or green or golden pigmented ring in the descimate membrane of the cornea due to copper deposition. And you can have a look at one more picture of this sunflower cataract in Wilson's disease, right? The next, anterior incisors of a child with white patches turned brown following over supplementation of. So this is a very clear case of dental fluorosis. Fluorine in drinking water is high. That's why. So this is dental fluorosis. I'm showing you the picture. Safe limit of fluorine is around 1 parts per million in water. More than 2 causes chronic intestinal upset. More than 5 will lead to dental, teeth, discoloration, mottling of enamel. So there's decreased mineralization in enamel. And levels more than 20 are toxic and will affect the bones, right? So first GI system is affected, then dental fluorosis occurs, and then skeletal fluorosis occurs. Which of the following is true? Question asked in Jan 22 exam, 23 exam, Jan 23. So about the comparison between creatinine and inulin clearance. Answer is creatinine clearance is greater than inulin clearance. This is also a common sense question. Creatinine, we all know that creatinine is coming in urine, right? So, and inulin is neither secreted nor reabsorbed. It is ideal substance for GFR, right? So the clearance of creatinine is more. Creatinine is coming out in urine compared to inulin, because inulin is neither secreted nor reabsorbed. It is ideal for GFR because it is neither secreted nor reabsorbed. On the other hand, creatinine is secreted out. So its clearance is more, right? Clearance out of the body is more. Then a patient having excruciating pain all over the body and went to hospital. This pain occurs after exercise. Patient has anemia with elongated RBCs. Sickle cell anemia diagnosis is made. So what is the mutation? What is the answer? Everybody knows that glutamate substituted by valine at 6th position. So in sickle cell anemia, elongated RBCs are there. Elongated sickle-like RBCs are there. It's a point mutation. It's a transversion GAG to GTG because purine replaced by pyrimidine. A to T. Purine replaced by pyrimidine. And from polar to non-polar amino acid in the mutation. Glutamate to valine. Glutamate is polar and valine is non-polar. So there's sticky patch. Right? Child is suffering from, this is kwashiorkor. The edema is very much visible, right? Distended abdomen and the edema. So we can read this. Kwashiorkor occurs usually in preschool children 1 to 5 years of age. Marasmus occurs in infants less than 1 year of age. Kwashiorkor is usually due to low protein intake, but marasmus low calorie intake. Protruding abdomen and subcutaneous fat reserved in kwashiorkor, but marasmus child is having prominent ribs. Good appetite in case of marasmus and not in kwashiorkor. Skin changes also in marasmus, pigmented and flaky skin. You can see a dark child here in the picture. Peripheral edema is present in kwashiorkor. In kwashiorkor, round or moon-like face, but in marasmus, old man-like look. Old man-like look, right? So there's severe growth retardation in marasmus compared to kwashiorkor. Then this graph of non-competitive inhibition was given, was asked in the question. So you should do the graphs of competitive and non-competitive. So this is Lineweaver work plot. Like this straight line graph comes. The point on x-axis is -1 by km. The point on y-axis is 1 by Vmax, right? So this is non-competitive inhibition. In case of competitive inhibitor, Km will be increased. Km is increased, Vmax is same, right? So what did we see? We saw in the last graph here, in this graph, can you see? Km is same and velocity is decreased with the inhibitor, right? So that is non-competitive, Km same, velocity decreased. In case of competitive, Vmax is same and Km is increased. In case of uncompetitive inhibitor, a parallel line will be there. Both Km and Vmax decrease, right? So these are the topics which are highly recommended from my side to revise before the exam. Exam is very near. I know you'll be having now in hours, you will be doing your subjects. So just give 1 or 2 hours or 3-4 hours if you can give to biochemistry and revise these frequently asked topics. And the mind is in flow state when exam is very near, so the absorption power is really high. You may not trust it, but it will happen during the exam. You will remember and you'll thank yourself for doing this revision, last minute revision. So don't be afraid of your subjects which you have not done. I hope I'm able to activate you for the subject so that you can read this subject now. So all these yellow marked, mostly I have covered. I've tried to cover these. So rest you can do yourself, right? So very best of luck for your upcoming FMG exam. Do read each and every question very carefully. Each and every word in the question matters. And always make it a habit of reading all 4 options, right? Do not make silly mistakes. So this is it. Bye-bye. Ending with a motivational quote by Dr. Swami Vivekananda. Everything is easy when you are busy, but nothing is easy when you're lazy. So you're really busy when exam is near, you have a lot of subjects and your mind is in flow state. So at this point of time, it has high catching power. So do the best and best of hard work possible, whatever best you can do, right? Bye-bye, best of luck.